Hi, everybody. Welcome to the Valley Health Virtual Health Fair. This is the first year that we are doing a virtual health fair, and I am so glad that you've decided to join us. My name is April Lepkeman, and I am a licensed clinical social worker with Valley Health in the outpatient behavioral health program. And what I am here to talk to you about today is coping skills, and in particular, coping skills that we can use during stressful situations. So, life is really full of stressful situations that we can't control. What we can control, however, is our response and our responses to stressful situations. There are infinite ways that we can cope, and some ways that we cope will be different than how other people cope, and that doesn't matter. My hope today is that you will take a look at this list of coping skills that I'm going to talk to you about, and that you will either expand on them or you will start your own list. So let's get down to it. What are coping skills? Coping skills, which I will also be referring to as coping strategies or coping mechanisms, are tools and techniques that we can use to help us handle difficult emotions, decrease stress, and establish and maintain a sense of internal order. They can be helpful to use when we're feeling angry, when we're feeling anxious, when we're feeling stressed, overwhelmed, depressed, even when we're not feeling physically well. They help us stay level. So I'm going to review different types of skills, and just so you know, I will use coping skills, coping mechanisms, and coping strategies interchangeably, but they all mean the same thing. So the first set of coping skills that I want to go over are social or interpersonal coping skills. These skills are focused on drawing strength and wellness from the relationships that we have with others. So if you are somebody that says, you know what, I don't need that because I am somebody who is really introverted, I don't really need social coping skills. I would politely disagree with you because we're human beings, we're social animals. That's just how we're born. Even if you are somebody that tends to be more introverted, you draw some strength from somebody around you. So let's say you don't have a social network per se. Maybe you have a primary care physician that you connect with. If you don't, then maybe it's a therapist, maybe it's a psychiatrist, maybe it's a grocery store clerk. It doesn't have to be somebody that you traditionally think is in your family or needs to be a close personal friend. So, what are these sets of coping skills? The first coping strategy is talking to somebody that you trust. Obviously, that's very important. Just the ability to get the things out of your mind so you are not bouncing ideas off of yourself and you're bouncing ideas off of somebody else. So, one of the things that we do in my outpatient behavioral health program is group therapy. We have a lot of folks in there that are not used to talking about their feelings. And I've heard more than once, boy, I'm so glad I was able to get this thing off of my chest. Not for somebody to fix it, but just to hear what other people have to say. Or maybe not even that. Other people have said just to be able to say it was helpful. So another coping skill is to set boundaries, learn how to say no. That's so difficult for so many people. I know it's difficult for me. But here's the thing I want you to remember. If you are constantly saying yes to things you do not want to say yes to, you are then saying no to yourself. So really set those boundaries. If you don't want to do something, and let's say you're put on the spot and you feel like you have to give an answer right away, that should be an indication to you that you should not give an answer. And you can say, can I think about that and get back to you? And really think about whether you want to say yes to whatever it is that somebody is asking of you. Write a note to someone that you care about. Whether it's to say, I've been thinking about you and I care about you. Or to say, it was so nice seeing you the other day. It really put a smile on my face. Sometimes it's helpful just to get out of our own brain and to give to somebody else. Encourage others. That's a partner to the last coping strategy I just gave to you. Again, getting out of our own space and giving praise, giving encouragement, giving validation to others is actually a wonderful coping skill to use. Role play challenging situations with others. So I don't know about you, but I'm a slow processor at times. So if something happens and I'm having an interaction with somebody, it can be difficult for me to think right on the spot what I can say that is appropriate. So sometimes I'm really quiet because I have to think about it. So what is helpful is if you have somebody that you trust, or if you have a therapist, to ask them to be you, and you be the other person. This does a couple of things. It allows you to be in the other person's space and maybe to have some empathy for that person. And then the other person being you gives you a chance to look at exactly how you are responding. Care or play with a pet, or care or play with somebody in your family. So I just did a whole group therapy session on the importance of play as an adult. Somewhere along the line between being a child and being an adult, we lose that ability to play. So cultivating that sense of play can really help de-stress us, and it can help inspire curiosity. So what does adult play look like? It can look like something as simple as going outside, laying on the ground and looking at the clouds. It can look like stargazing. It can look like just taking a walk in the woods and not having any expectations, and just be curious about your environment. Spend time with friends and family. Use humor. That is always important and can sometimes bring down very stressful situations. Be assertive. So a lot of people get confused with being assertive and being aggressive. I just want to let you know what that means, assertive communication and assertive behavior. That just means that you're being upfront about your feelings. You are being upfront about what you need at that particular moment, and that you are telling people exactly what it is that you need from the situation in the moment that you're in it. Being aggressive is a whole different ball game. Being aggressive basically means being frightening, being violent, putting people on the defense. That is not what you want to be. But being assertive is a close cousin to setting boundaries. Those two things really go hand in hand. So now what I would like to do is talk to you about coping mechanisms or coping skills that are called cognitive and limit setting skills. So what these are, this is any kind of mental activity to help manage a stressful event or situation. So this could be anything from making a gratitude list, where I'm going to stay here for just a minute, because I don't know about you, but I've heard a lot about gratitude within the past few years. And I've also heard a lot of people in group therapy talk about their gratitude list, and they have the same 3 things on their gratitude list every day. That's not what a gratitude list is. What I am thinking about and talking about is every evening you sit and you reflect on your day, and you think about what has happened throughout your day that you're grateful for. And a lot of people, their default setting is, I have nothing to be grateful for. My days are the same. One thing is the same thing that happens the next day. It's the same thing that happens the next day. But I think that you'd be surprised if you were to focus and you were to think about, let's say when you were at the doctor's office, was there someone that was kind to you at the front desk? Did somebody give you a seat? Did somebody move aside to let you go in front of them? So I challenge you to think about either 1 to 3 things that you can be grateful for. And now what I'd like to really introduce here is journaling. I am a big fan of journaling. So when we're talking about that gratitude list, get a journal. If you don't want to buy a journal, just get a spiral notebook, because one of the things that our brains will do to us is when we are in bad situations, they will forget everything. Brains are really good at that. So you have to be documenting these things somewhere. If you are uncomfortable writing, then get yourself a recorder so you can record your gratitude list. Brainstorm solutions to a difficult problem, but make sure that you are putting time limits on that. One of the things that you can do is you can set aside time during each day to worry about issues. I know that sounds a little strange, but it's actually quite helpful. And when you start to worry about situations out of that time frame, gently guide your brain back to the time frame that you have set to worry. Now, how does that relate to brainstorming solutions? The time that you are worrying, I want you to be brainstorming the solutions to whatever it is that you're worrying about. Lower your expectations of whatever situation that you're walking into. This can be really helpful in keeping us mindful and keeping us present. So instead of looking toward the future and saying, oh my word, I wonder if this is going to happen, or this is going to happen, or I think the worst case scenario, to say to yourself, I will have no expectations of whatever I'm walking into, and whatever it is, and I will deal with it. Keep inspirational quotes with you. Again, this is where your journal comes in. It is so helpful to journal things that people have said, things that you have read somewhere, and you keep them in your journal and you review them. That can be something that can be really helpful to bring you down when you're feeling anxious or stressed. Write a list of goals, but be very careful with that list. Make the goals achievable. So make sure that you are thinking about things. What do I want to do within the next 15 minutes, half hour, 24 hours? Don't think about the next month, the next 2 months. If you've not set goals before, you have to start small and you have to make sure that they're achievable. Otherwise, you won't want to set goals in the future. Take a class online. There are so many free online classes right now. Anything that you are interested in, you can Google and you can find a class for it. Accept a challenge with a positive attitude. That's another good coping skill. So, not many of us like change. Change is hard. But you would be really surprised when you accept a challenge and you get into that spot of change and you accept the challenge and you complete the challenge. It's amazing what it does for your self-esteem. Write a list of your strengths. How many of you can say that you've done that? Again, this is where your journal comes in. Writing a list of strengths can be helpful to remind us of the things that we are good at, because our brains are so good at telling us all of the things that we are really not good at. Writing that list of strengths can help us remember what we are good at. Act opposite of the negative feeling that you are having. So, if you are feeling really angry, take a few breaths and think about what you can do that can make you act the opposite of angry. So that might be that you have to channel up some good memories of something. You might have to watch something that is funny, so just distract yourself to bring some of that anger down. Write a list of pros and cons about a difficult decision. Again, writing a list in your journal. So that is a really helpful thing. And that can also go for your brainstorming. That can be helpful during that time that you are scheduling for your worry/brainstorming sessions. Now, the third type of coping strategy that I'm going to talk about is a tension release coping strategy. And these are coping skills that help us release bottled up negative energy. Have you ever had the feeling where you are just so angry and tense, where you notice your shoulders are up near your ears, your fists might be balled, and you feel like a shaken up soda bottle that has the cap on and you are just about to blow? So this is when to engage in these types of coping skills. So crying. Crying is a wonderful way to release, and it helps cleanse. I had somebody in therapy the other day say, I just kept crying and crying. I didn't know what I was crying about. And it was about a 45-minute session of crying, and I felt so much better after I did it. And that was her just releasing her tension valve. Laugh. Laughing is always a wonderful thing to do that always helps us. Goes along with humor. Go outside, yell, jump up and down on, in your yard, on your driveway. That is so helpful for releasing tension. Okay, so now we're going to talk about physical coping strategies, which are coping strategies that are good for our bodies. So get enough sleep. How difficult is that, especially right now? So let's stay on that for a moment. When I say get enough sleep, and most of you say, my sleep is a mess, do you practice sleep hygiene? Because sleep hygiene, these are coping skills that can help you get a better night's rest. So that means turn off your screens an hour before you go to sleep. Make sure that you are going to sleep at around the same time every evening. Make sure that the only thing that you are using your bed for is sleeping and for intimacy. Make sure that if you are in bed for more than 15 minutes and you can't get to sleep, that you get up and you are doing something that is just kind of mindless. That can be washing the dishes. Although that's not fun, that's pretty mindless, and that can get you to sleep pretty quick. Also, reading a book that you've already read, so you already know what the outcome is, so there's no interest in it. That can also help you go to sleep. So that's just a part of the coping skill of getting enough sleep. Eat healthy food. Get into a good routine. So you know how I just said it's important to go to sleep at the same time every day? It's also important to get up at the same time every day. It's also important to shower or bathe, brush your teeth at around the same time every day, even if you don't have to do it. Just getting into a routine is good for your body. Get some exercise. So if you're somebody that's not exercised in a very long time, you would be so amazed what you can find in a search on YouTube. Exercise for beginners, chair exercise, chair yoga. You can find everything from advanced exercise all the way to exercise for beginners. Limit caffeine, especially after 3, because that will affect how you sleep. Practice slow, deep breathing. So what I mean by slow, deep breathing is you don't want shallow breaths because you can hyperventilate. Not good for you, not a good coping skill. But what is good for you is if you put your hands on the top of your stomach and you notice when you're taking deep breaths that your stomach is rising and falling, then you are actually taking deep breaths. So those are the physical coping skills that we have. Now I want to talk to you about spiritual coping skills. So what I mean by that is these are skills that help focus your thoughts and find peace of mind. So that can be getting involved in a worthy cause, enjoying nature, meditating. If you are somebody who is religious or if you believe in a higher power, you can pray. Those are some very good spiritual coping skills, getting out and being around nature. Now let's talk about something called diversional activities. So diversional strategies are as important as coping skills, but here's how they're different. They allow you to stop thinking about a situation contributing to your distressed emotions, at least for a period of time. These techniques aren't necessarily meant to be the final solution, but they can be quite useful in keeping you safe, distracted, and just give you a little bit more time to help you think more clearly. So, what are distraction skills or diversional activities? They're one and the same. They're writing, drawing, painting, photography, reading, playing an instrument, taking a break or a vacation. Now, let's just stay on that one for a minute. I don't mean that you need to go away on vacation. Take a mental vacation. Unplug your phone. Unplug your computer. Don't answer your emails. Give yourself some time to just be in the quiet or just enjoy something that you have not been able to enjoy for a while because you've been really busy. Read. Clean out a drawer. Clean out a room. But like I said earlier about setting goals, this cleaning out of things, make sure when you're cleaning things out, you're starting small so you don't overwhelm yourself. Go shopping for things that you really need. Watch a movie. Watch something funny on YouTube. These are some good diversional activities. The last one is going out for a drive. So I hope, like I said earlier, that this will help you start your own list of coping skills or your own list of diversional activities. But the other thing that I really hope is that you look at this as the beginning of building your wellness toolbox. So I mentioned that in the very beginning of this presentation. What is a wellness toolbox? All that means is that you are gathering coping strategies and diversional activities that help to de-stress you, that help to calm you, that you are willing to use on a regular basis. If this is something that you're more interested in building your wellness toolbox and learning more about coping skills, and you're interested in doing this through group therapy, please call us. We would love to hear from you. So again, my name is April Lubkeman, and if you're going to call us, you would be calling the Valley Health Outpatient Behavioral Health Program, and our phone number is 540-536-4881. Our phone number in Shenandoah Memorial Hospital, that's where I am, the number I just gave you is Winchester, is 540-459-1505. Know that we serve people in group therapy who are 18 or older. We would love to hear from you. And again, thank you so much for joining me today.